to be mindful for everyone's time, so we will let people in as they come along. I want to start by introducing myself. My name is Muna Abdullah Hajazi. I am the ASAP Community Coalition Coordinator, and I am Access's Community Health and Research Center's Community Engagement Manager. It's a mouthful. I want to thank you guys all for joining us for our ASAP's Prevention Week, and today's session is Partnerships and the Power of Collaboration in SUD Prevention. We have wonderful speakers today here. We have people from the school systems. Our evaluator is on here today, and we also have two of our partners from the Dearborn and Dearborn Heights Police Station. So we are really happy to be able to talk to you guys all today about the collaboration that we have all worked together throughout the years, especially during the last year, during the pandemic, and all the changes that we all had to make to adjust to our work, and the continuous efforts that we have worked together in order to serve the communities of Dearborn and Dearborn Heights. So I am going to start off by letting our speakers introduce themselves, and then we will move into some questions until about 4 o'clock, and then we will leave it open to Q&A. So if you have any questions, please wait until the end, and we will open it up to the audience. Hela, do you have anything you would like from the audience before we move forward?
Yes, hi everyone. Thank you for joining us today. We're very excited to begin and have amazing discussions. I'm going to send in the chat box a link, and this will lead you to a Google form where you will sign in for this session. And it's very important that you do sign in because we'll use your email in order to send you the assessment afterwards. And then you would use the assessment in order to get the continuing education units. So I'm going to send that right now. And we just ask that everyone signs in with the link. Thank you.
Thank you, Hela. As I said, we're going to start off by allowing our speakers to introduce themselves. So for our first speaker, Mr. Sharafiuddin, if you can please unmute yourself and introduce yourself.
Hello, everyone. My name is Wissam Sharafiuddin. I'm the HES Academies, that's Hamada Educational Services Academies Family Engagement and Community Liaison. HES Academies is K-12 charter public schools that serve the Metro Detroit area in the cities of Dearborn Heights, Westland, Sterling Heights, Detroit, and Canton. They serve through Star International Academy, Universal Academy, Universal Learning Academy, and New International Academy. Thank you.
Thank you, Wissam. Next, we have Dr. Cass Anderson Carpenter.
Hello, everyone. My name is Dr. Casten Anderson Carpenter. I'm an assistant professor of psychology at Michigan State University, and I've been working very closely with Access and the ASAP Coalition since 2017.
Thank you. Next, we have Aaron.
Good afternoon. I'm Aaron Morandini, corporal with the Dearborn Police Department. Currently assigned to the Youth Bureau and work with Access for probably the last couple of years.
Thank you. And finally, we have Captain Smith.
Hi, my name is Corey Smith. I'm a captain with the City of Dearborn Heights Police Department, and I oversee the investigative bureau here and support services. And we are just a new member of the coalition since the beginning of this year.
Thank you. So thank you all for joining us. I'm going to go ahead and get started with our question session, part of the session right now. And our first question is going to go to our speaker, Wissam. Wissam, you talked about the work that you have done in the schools. And I know that you guys have constantly stayed up with changes and adjusting to different things that come your way and really working to find new ways to accommodate the students of the HES system. While working remotely right now during the pandemic, and I know the challenges that many of us faced during the past year, how did the COVID-19 pandemic impact your work in the educational field?
Yes, thank you, Mona. So I work with the family engagement and I work also with student government. So my answer will be geared more towards family engagement and less towards class. You can harvest them. So with the pandemic, parents and teachers were challenged and forced to adapt to technological methods and employ them for engagement and communication. The adaptability curve has turned sharply and became exponential. Basically, within weeks, everyone has adjusted to the new ways of communication because they had no other choice. They were the only ways to really continue the learning process. Social media became a tool for education and communication rather than mostly for entertainment and leisurely connectivity. We broadcast the superintendent's message on a weekly basis, and parents could engage with her directly through comments. Principals spoke directly to families and engaged with them electronically through live broadcasts. And we facilitated weekly live broadcasts on Facebook and YouTube of every academy that reached higher numbers than what we are used to. Also, the recordings were saved for future reference. We addressed mental health needs, technology tutorials, and various parents' needs, substance abuse needs via virtual professional development sessions by experts continuously and in dual language to accommodate our parents. ASAP, of course, played a big part of providing these sessions for us. We had social workers and counselors, even students share directly with the community tips of their virtual learning and tips for handling mental health needs and etc. Community organizations such as ASAP were ready to deliver. Other organizations too, participated. So more work is needed, but we have now the infrastructure for super communication with the parents, and we are going to build on it for the future and keep on improving.
Thank you. So, of course, it was a challenge for all of us to go on a virtual platform, and then I can't imagine for the students. I know that there was some parents that needed help with adjusting to the virtual platform. Obviously there's parents who also have tech set and who are, you needed help with being tech savvy, understanding how the virtual platform works. And I know this caused some stress for some parents and for some students. What are some of the mechanisms that you guys applied to your students and to your parents to help with those efforts, to help ease the stress and the anxiety of being home? And I know with some families, there was multiple children in the home and space was an issue about being able to hear your teacher and being able to communicate with the students. So can you tell us a little bit about how you guys navigated through this?
Yeah, so first of all, within the first 2 to 3 weeks, we have distributed Chromebooks for all our students. Really, all the staff, they came together to make this process as smooth as possible. And we utilized technology to just the easiest way to sign up for them and to dispense them. And we also distributed headsets with these Chromebooks. And for students who, the internet services were providing all kinds of packages for parents during the pandemic. But even for those who could not get any of these, we had Wi-Fi stations that we would distribute to parents who needed that. So no parent needs to go there, take their children somewhere else to get internet access. So, we made sure that every student has that full access, and then we distribute tutorials and, instructions, really graphical instructions, made it easy for them to know how to use the Chromebooks, both in Arabic and English. So we got them connected, and we very, very fast trained our teachers on new platforms and transitioned the learning process to online. And something I think we did that was very important is that we did almost, first it was like almost bi-weekly, and then we did monthly feedback from the parents. So we were trying to solicit as much feedback as possible to adjust accordingly. So even the schedule adjusted as we try things, so like, for example, we found out that we need more live sessions and less asynchronous learning. So the students have more structured days. So we introduced more live sessions. So the feedback was very important, and just the adaptability, the ability to change. And after we got comfortable with learning, we even went to even extracurricular activities. We started doing them virtually. Student government resumed. They did their campaigns and elections online, and we did Google Classrooms for each student government, and we have weekly meetings, and They also took lead, like the student government as a representative of the student body would bring some suggestions and advice to the administration and give feedback on their daily learning. And they themselves, they presented like broadcast, they presented sessions on how to manage virtual learning, some of the tips, what's some of the important things to maneuver that. And all the way to even if a parent is really having a challenge with all these steps, then they can at the end of the day come to the school. So our schools remained partially open to accommodate such cases. Our IT department provided support every day, so parents can bring the Chromebook with all the CDC requirements in place. We would facilitate for them wherever need and tutorials they needed.
Thank you, Issam. Thank you so much. I'm going to move on to our next speaker, Aaron. Aaron, you've been a partner with us for a while now, but very closely to ASAP for the last couple of years. How does your collaboration, and can you talk a little bit about the collaboration work that you do with ASAP, with our SUD advocate, our substance use disorder advocate, Ahmed Balut, allow you to support our community members who are looking to get into treatment?
Sure. Firstly, I think identifying people in need of treatment is our biggest influence with access. So working with the police department, we're the first responders to any kind of overdose incident. So we can identify those incidents, and then we can make referrals to access. So people that have overdosed or struggle with substance abuse can get the treatment if they desire. Not everybody does, but people who are looking to break that cycle of addiction don't always know where to go. So once we identify them, we can refer them to access.
Can you talk a little bit about how your day goes when you guys are working together, with your home visits?
Sure. Typically, we'll go out and I will, working with the police department, I'll identify any kind of overdose incidents we have, and we will go out and follow up with those people who have been involved in the incident, introduce ourselves, and offer support to the people that have overdosed, to their families. Again, historically, police are seen as like the bad guys. If you use drugs, we're going to arrest you. With the decriminalization of substance use now, we're kind of turning the corner, and they're seeing us more of a partner now. They'll see us with access. Know we're there to kind of get them into services, so they don't repeat the cycle of overdosing, and again, just help them break their cycle of addiction.
And how has your work been impacted by the pandemic? I know you guys went through a lot of challenges to continue this work, especially when we were at a stay-at-home order in the beginning of the pandemic. I know I can speak on behalf of Ahmed. It must have been about a couple of months into the pandemic, and the number of calls that we had been receiving for mental health calls and other types of need for treatment was increasing, and people were used to you guys going out and visiting them in their homes. And then with the safety measures that we had to put into place, we had to come up with a plan to keep you guys and others safe during the pandemic. So you guys, wanted to go back out, wanted to get on the ground. But I know that you guys had some challenges, and I know it's a little bit harder now to be out there. But can you just talk about some of the ways that you guys kind of overcame these challenges? And I know that you guys also provide, I know Ahmed is a naloxone trainer. So if you can talk about that as well.
Yeah, it was during the beginning of the pandemic, it was definitely a struggle. Again, working with the police department, being a first responder, seeing the overdoses and not being able to follow up with access to get them into treatment. I could see the need for it. Because again, with the remain lockdown, we definitely had a higher incidence of overdoses, suicide attempts. those definitely were on the rise. So once we started getting back in the community, we had a lot of catching up to do, and we did it. Thankfully, it was towards the warmer season, so we met people outside of their house, and we did what we did. Not really much changed in that regard. We'd go to their houses, meet them outside, offer them treatment, services, if they were willing. In regards to the naloxone, Narcan training, again, working with the police department, I'm not a Narcan trainer, but I know, and I've used it in the performance of my job, so I know there's a need for it. And I also know the places where we have a lot of overdoses. So I could refer Ahmed to where I thought the most overdoses occurred, and we went out and provided Narcan training to those either businesses or houses. And he was, so just to give you a quick stat, businesses in the city of Dearborn, we had 63 of them are fully trained in Narcan and have a Narcan kit now. Those are including like gas stations where we had some overdoses, hotels, and other businesses. So we'll continue to do that as well.
Thank you so much. And thank you guys for everything you guys do for our community. I'm going to move on back to Isam. Just to talk about the future of prevention in Hamada schools. You know, can you talk about what do you think needs to come along? Hopefully the students will be able to come back in person. I say that with a huge hopefully as a parent, because I'm ready for the kids to go back, I think, fully for all of our sakes, for their sake especially. So can you talk about a little bit about, like, what are we still, you know very well that we're always looking to increase our efforts and to keep up with what changes need to come. And I know that's how you guys are as well at HES. Can you talk about what prevention efforts you think will need to continue or need to be brought up in the next upcoming school year? Just unmute.
I've noticed. So we have been facilitating family engagement broadcasts every Friday, and we call them community broadcasts because they're open for everyone. And the reason we do them on Fridays is like we're creating a ritual, we're creating a habit for our parents that you can get all the updates. And you can get a great professional development session, a great talk on Friday. And if you keep up this habit, then it becomes a great weekly tool to communicate with the community. The more you increase the value that you're offering through these broadcasts. And afterwards, they are available. So if people search for them, we're also creating content. And we try, as you know, we try not to repeat a lot during the year, the same sessions. We try to offer some updates to these sessions. We try to offer some new information. Like the last professional development we did, we actually displayed and showed the different ways, for example, vaping, e-cigarettes are hidden. So the different, it was a hands-on, like it was an actual engaging podcast. So parents can actually see how vapes sometimes hide in different various forms and shapes. So they're then posted, and we even created podcasts, which is something new that we started this year. Is for every school there's a podcast, and there's also an HES Academies podcast that people can listen to during driving, or the podcasts are on the rise. So I think most of these changes are here to stay. I don't think we are dropping any of this technology that we have been utilizing, even if we go back to fully in person. What is after 2020 is a new era. So we are not looking back as much as we are looking forward. So we're going back, but all this technology that we have built and trained our parents on, we're going to continue to utilize for more engagement. Now parents have access to their schools through various ways. They have learned how to text the teachers through text messaging services that we have in place, how to directly connect with administrators. Forms are no longer this long process where they have to fill it and bring it to school. So things have become a lot more efficient, a lot more easier. And we want to continue that relationship. So our platform through our community is a platform where it brings resources such as ASAP and LAHC and different community organizations. It brings them to connect and present to our basically parents and communities on the needs of our students. So prevention is all about education, and we need to repeat the message over and over again and update it because things are always changing. So for example, in the last, as you know, the last couple of years, there have been more vaping concerns, less smoking concerns. Also with as far as substance abuse, there are more types that have become more prevalent than other types. So we always have to be one step ahead of these trends.
Thank you so much. We appreciate it. And I do have to say, I've worked with Wissam since I started at Access, and he always keeps us on our toes, wants us to stay updated and find new ways to stay engaged in the community. So we appreciate all of your efforts, Wissam, not only for HES, but like you said, for all of the community. We're gonna move to Captain Corey. Captain Corey, Dearborn Heights Police is one of our new partners on our opioid response team. Can you talk a little bit about the collaboration and the reasoning behind why you guys have joined us and the need?
Yeah, no problem. So the administration made the decision to become a part of the coalition to supply our citizens with information on how to get people with substance use disorder help due to the ongoing concerns nationwide. The administration knows the cost of the community that substance use disorder brings. As we all know, SUD ruins families, communities, and the nation as a whole. Our agency has seen the damage that SUD has caused in this city, and if we can do our part to help people get better, we will certainly do that. This is one positive step toward that goal. As we all know, SUD affects people of every race, ethnicity, and income level. By being able to provide the resources to people that our officers encounter, we're helping these people get better so that they can get better themselves and be a better part of the community. This coalition has been nothing but positive for us. Officer Hamza Yunus is making these contacts with Counselor Ahmed Balut, and it's been nothing but positive. We don't have a whole lot of data yet, as we're only kind of freshly new to this program, but so far it's been overwhelmingly positive.
Thank you. Can you talk about how important it is for the police department to be working with coalitions and to be working with community organizers on helping provide not only treatment, but prevention efforts in the community?
Yeah, I mean, for us, the collaboration is a big piece of the puzzle for the Dearborn Heights Police Department. I think as Aaron kind of touched on already, it's kind of obvious that jail isn't working for people that are suffering from substance use disorder. So any way that our agency can help provide people from suffering from this disease is a bonus for us, for sure.
Thank you so much, Captain Corey. We appreciate you guys joining our efforts and joining our coalition on providing not only treatment, but like I said, preventative factors. I know that the Dearborn Heights also is starting to place student resource officers within the schools. Have you guys seen some positive impacts through that with the students?
We are starting to see a little bit. We have 2 new SROs, school resource officers, within our city. It's been a long time since we've had manpower that we could actually supply that to get back into the schools. And our SROs work in close conjunction with Officer Hamza Yunus to provide any information on any families or students that are seeking help, and we can refer them to Access.
We thank you. And part of our efforts with Dearborn Heights, because as Captain Corey Smith had mentioned, they are one of our newer partners on this project. Dearborn Heights has always been a part of the coalition on different efforts. For example, the Dearborn Heights Police Fire department has always been a supporter, as well as the police station, but we have expanded into these opioid response team efforts since, I want to say, we started out in mid-February, beginning of March. And we, like he has said, we have seen nothing but positive feedback so far, and I'm really happy to see it now in both cities. I am actually, I was born and raised in Dearborn, but I am a resident of Dearborn Heights, and very heartwarming for me to be able to serve my community. And we also wanted to make sure that, you know, we work really hard on collaborating with all of our partners, because when it comes to mental health and substance use, on both preventative efforts and treatment, we know that we all need to come together to provide as many resources as we can for our community. You know, Wissam, I have one last question for you. You talked a little bit about, you know, moving forward, bringing, not looking back. And I, you know, was going to ask you, do you actually see that some of the students, you know, are actually doing better on a virtual platform? You know, what are, like, can you give me like about 2 examples of some positive since the virtual platform has been launched?
Yeah, actually, you'll definitely see both cases. You'll see some students excel and you'll see some students struggle. And the important thing is to accommodate both. So with our surveys, it's not really clear that students do prefer coming back to school. So, you know, there's also a variance in opinions in that sense. So some students, they basically, the environment, the distractions that can be in a classroom, they're all of a sudden removed. And also through the virtual platform, they're given all an equal share of the platform. So the stage fright or someone's tendencies to be more quiet in a busy environment, or you know, the extroversion or introversion tendencies, these sometimes they get worked out in the virtual system. And also students are given an opportunity to work more. The technology that we have utilized allows for students to go beyond their curriculum needs, and that some students will excel, given that differentiated instruction is facilitated much easier through technology. So yeah, definitely you'll see in both ways. And given that a lot of colleges and higher education is moving towards a lot of the online classrooms, or at least a lot of online dependencies, it is good to prepare our students for the future. So even going back in person, having that in place, having that structure, has positioned, I think, will position our students for success. It also will eliminate the issue of absences. If a student has to, they have learned how to continually be engaged with their studies, whether they're in school or not school. So I'm not sure if we're going to have any more snow days in Michigan.
I like snow days.
Yeah, everyone does.
I'm going to pause on the questions just to give you guys a little bit of understanding of ASAP and the school work that we've done. Since the coalition has been initiated within the school systems, we worked really hard on providing culturally sensitive presentations to our students and to our parents. And one of the things that I would say we are very proud of is that when we would be out into the schools, we would provide presentations for the parents, and then also provide presentations for the students that were aligned. And we would also tell the parents, when you go home and you talk to your student, you can ask them, who was in your school today, and they can let you know what we talked about. We wanted to make sure that parents were very aware of what we were discussing with their students. We wanted to be very transparent to our parents. And through our work, through our drug-free community coalition, when we were able to become a drug-free through DFC, through our funder, the CDC, once we became a DFC coalition, and prior to that, one of our largest goals was to have a youth group In the city of Dearborn, ASAP was the first coalition to receive the DFC funding. At the time was through SAMHSA, and now our funder through the CDC and ONDCP. It was a very tough journey we went through for about a year, but with our help from Dr. Carpenter and other people in our coalition, we were able to collect our own data and to provide our own research around why our community, which is predominantly Arab American, needed to be receiving these funds to provide prevention efforts in our community to address and to break the stigma surrounding substance use. And we were able to start the first youth group in our community that was addressing, our peers were addressing, our young students were addressing to their peers why substance use disorder needs to be addressed within the schools. And we know very well that students listen to students. And so our work is very student-led, student-driven. Hala Mallah is our youth organizer. She leads our youth group, and they have been phenomenal in the last 5 years. But I have to say right now, during the pandemic, they have shined brighter than ever. They have worked very hard to continue to do this work, to continue to address these different types of efforts among their peers and in their community. That being in the last couple of years, our students have been in front of the city council. They have done a photo voice project addressing youth tobacco use, vendor education. They have presented at the CATCA forum and the CATCA midyear. They are on the ground whenever they can be, and they just shine as bright as we can possibly ask from them to bring change within their community. And our hopes is that next year they continue to grow and that we have more youth leading this work because they are our future. So Hala, I want to thank you and really appreciate all the work that we have been. Hala started with us actually during the pandemic, which was a very unique time to be taking on any type of work, especially working with youth. And she's been very patient and found new ways to keep them going and engaging because they're very used to us being in their schools and in person. So moving to a virtual platform was something that we all had to adjust to. So I wanted to just take a moment and talk about our efforts through that. And, we're very thankful to have the funding that we have to continue to do this work within our community. Aaron, we've talked about this many times, the role of stigma surrounding substance use. Can you talk about when you guys are out there and what is the impact that stigma has on your work?
Sure. Obviously, stigma is a huge barrier to providing treatment, especially in this community, the Dearborn community. Substance abuse is looked really down upon, like a family systems failure. So it's hard for people to admit that a loved one or even themselves might have some kind of substance abuse issue. In addition to the stigma of substance abuse, there was always attached that legal issue with it. Being arrested for using any kind of illegal substance. Again, with the decriminalization, we're hopefully moving away from that. And I've seen it over my years that we're able to reduce the stigma a little bit with decriminalization and just education.
Thank you. Captain Corey, would like to add on to that?
Sure. Yeah, stigma is definitely attached to anybody asking for any type of help. That applies to mental health as well. I'm sure Aaron could tell you stories about officers that are afraid to get mental health help because of the stigma attached to it. They always are worried that the community or the place that they work is going to frown upon them asking for the help. The stigma attached is being weak or something of that nature. That is definitely a hindrance toward getting help with substance use disorder or mental health issues. It's always been an issue, and this type of work, this type of platform is definitely a positive step toward decreasing that stigma that's attached to it. This is great.
Thank you. All right. Captain Corey, what does the future of this collaboration look like for you? Like, what do you think we're gonna what's gonna come out of this? What do you hope can come out of this?
Well, I hope by next year we can have some more where I can actually give you some actual positive stats, because as of right now, Officer Henza Yunus and Ahmed Balut have not been able to make that many contacts, but they have made quite a few. I hope next year we'll have a lot more statistics that I'll be able to supply and some positive stories. But I definitely see this collaboration and coalition work continuing with the City of Dearborn Heights Police Department, for sure.
Thank you so much. I have to say, when I first time I think I met you in person was when we had to do a video.
That was uncomfortable.
It was interesting because I had not been to many outreach events in person outside of the Access vaccine sites and the testing sites. So it was one of my first time going to an event. And we were doing a video, which I think was a good idea because it showed the work that the coalition and the police station are doing together. Social media platforms right now has played a large role in our work to get the word out there, along with being on the ground, right? I mean, we have to continue to stay on the ground and to continue to help our community, because we know very well that not everyone can actually have access to social media, right? Like, as much as we are all very used to being on this virtual platform, sometimes, not everyone has access to it. I know that, a lot of work has been done, as Wissam had said, to make sure that people did have access to the internet, people had access to some type of tablet or a computer or some access to the internet. So I know that that's been a change in the pandemic, and that's something that's going to be part of our future. But it is also important that we are on the ground and we are face to face. So thank you guys. I am going to move to our last speaker, one of my favorite people. Dr. Carpenter has been a mentor, a partner for me since the beginning of this coalition. I feel like the stars aligned that day when we decided to work together, because it was actually prior to the DFC funding. So Dr. Carpenter, if you can talk a little bit about actually our partnership, and then I will let you move into the data that you would like to show us.
Sure. Thank you, Mona. So our partnership began in 2017. I would say early to mid 2017. And Mona and I had the pleasure of working with some colleagues out of the University of Michigan for the community-based participatory research training academy. And this academy we were one of 12 academic community partners from around the country who participated in this week-long training. And when Mona and I first saw each other, we realized that we would be fast friends. And so as you can probably see and hear from my voice, I am not from Michigan. I'm a Louisiana country boy from right outside New Orleans, but I've always had a desire to work with the Arab American community and people from the Middle East and North Africa. And hearing the rhetoric that was going around during the 9/11 tragedy really solidified my desire to work with people of the Muslim faith, people who are Arab American, people from the Middle East and North Africa. And I'm a behavioral psychologist by training. I'm also a board certified and licensed behavior analyst. And I was trained in community-based participatory research because my philosophy towards science is that science is for the people, not for those of us who might sit in an ivory tower. And if I can't bring my training to the communities that I serve and teach them how to do what I do, then why am I even in this profession? So that's the spirit in which I approach science. And so since I've been working with the ASAP Coalition, I've been working with Mona and working with other members of the coalition to collect data so we can have some empirical basis that drive our work. We know that it's working in the communities. We have the social validity from the community members. We're saying, yes, this work really is important. And now we're in the process of gathering the data to support what we're doing. Because as it stands, there's really no research looking at community-based approaches to address substance abuse within Arab American communities. So the ASAP Coalition is in a great position to create that knowledge, not only for the scientific community, but more importantly, for the communities that we serve and live in. And so I'm going to talk a little bit about some of the data that we've collected. And I'm going to share my screen. Yes.
I think if you guys can make him co-host, please.
Okay, I can share my screen now.
Thank you.
Okay. So before I do that, I do want to talk about a community assessment we conducted rather early in our partnership. So what we wanted to do was look at, first of all, why do we even need this research? Well, the issue of substance abuse is prominent and it's prevalent not only within other populations, but also within the Arab American community. And I will say that doing this work with Mona and with the coalition, it really opened my eyes to a community and to a culture that I've always wanted to learn more about, but never had the opportunity. So a lot of this work is me learning from the community who are my professors. So when it comes to even understanding how many Arab Americans are living in the United States, there's this big discrepancy. The US Census says it's about 1.7 million, but the Arab American Institute says it's actually more like 3.7 million Arab Americans living in the United States. So that's a difference of about 2 million people. And so even not understanding how many Arab Americans live in the United States, we could kind of see why the issue of substance abuse may not have been given the appropriate and proper priority as it has in other communities. And so what we really wanted to do was look at, how do Arab and Chaldean Americans perceive the impact of opioid and heroin use in the community? And also, what are some of the barriers and assets that exist in the communities? A lot of research is geared toward looking at the disparities and looking at the barriers to care. And so we're really looking at a strengths-based approach. Why don't we look at some of the assets? What are some of the resources that are already available in the community that can be leveraged? What are some community partners and partnerships that can be brought to the table that may have been, not at the table and contributing as they may have wanted to? So these are some of the things that we wanted to look at. And so this was done in partnership with Access in my lab, the Advancing Community Empowerment and Social Justice Lab in the Department of Psychology at Michigan State. And so some of the things that we found was that there was a lack of culturally tailored and culturally responsive services, meaning the substance use services that may be available in the Metro Detroit area, the services, whether it's the implementation, staff knowledge of the Arab American community, that was lacking. And we know from the literature, from the scientific literature, that having cultural competence and cultural humility shown not only in interactions between staff and clients or staff and patients, but also in the implementation of services and how services are delivered, having that cultural competence and cultural humility goes a long way to improving population health level outcomes. And so we found that it was not only a lack of the services, but there's also stigma. And we see the stigma of substance use and substance abuse show up in a lot of populations within the United States and globally. But that being said, the community members really see Access as a trustworthy source of information and resources, and that the services provided by Access when it comes to substance abuse are comprehensive, because substance abuse is not just an individual issue. It really concerns the entire community. And so one of the things that we're looking to do is how do we bring in multiple community sectors at multiple levels to address this community-wide problem? And so one of the things we did was, and Mona alluded to this earlier, was we did a one classroom or one class period short presentation as the intervention to examine students' knowledge of substance use, to assess how likely they are to use tobacco and heroin in the next 30 days. To what extent do they believe that at least half the peers in their grade have used at least one substance in the past 30 days, and the extent to which they perceive a risk of harm. And so again, this was just after one presentation. And so I'm going to show you some of the results. Okay, so the results suggest that, before this lesson, before the intervention, students scored on a scale of 1 to 6, with 6 being the highest and 1 being the lowest. Before the lesson, students rated their knowledge about substance use at about on average of 4.12. And this was a sample of 271 students. But after that one lesson, the students' knowledge of substance use was rated 5.35 out of 6. So this is basically going from high knowledge to very high levels of knowledge. And this change was statistically significant. And so I'm going to show you another slide that I've kind of condensed for readability. So for the graph, the blue bars are the pre-test. So they were given the questionnaire before the presentation. And the gray bar is post-test, so after the presentation had ended. And so I'll show you the results for tobacco use, marijuana use, perception of harm, and the percent of students indicating that at least 50% of the people in their grades have used substances in the last 30 days. So what we see is that for tobacco use, the scores did jump as far as the percent of youth saying that they would not use tobacco in the past 30 days, from somewhat likely to unlikely. It's basically the interpretation of how the data went. And so this was a statistically significant increase in the percentage of youth saying, no, we're not going to use tobacco in the next 30 days. We also see for the risk of harm that marijuana can do to the body, the percentage of students before the presentation who said yes, that it does cause harm, was about 43%. And then after the presentation, it jumped to about 60%. And so on the rating from no risk to great risk, the perception of risk of marijuana to the body, to the mind and body, went from a slight risk to a moderate risk. And so, although that doesn't seem like a large change, it was statistically significant. And this was after just one presentation in a class, or one class presentation to multiple classes. And so substance use has been seen as harmful to the mind and body, regardless of the substance. And perceptions of peer use in the past 30 days did increase significantly. And so, although it seems counterintuitive that students would say, okay, after this presentation, I believe that more students believe that at least half of the students in their grade have used substances in the last 30 days. One way to think about it, and I encourage us to think about it this way, is that that may be due to the students' knowledge increasing about substance use and knowing what substance abuse and substance use is, what are substances, what are, we know about alcohol and tobacco, what are some of the other more illicit drugs that are out there. So that increase in peer use could be tied to the knowledge that students gained from the presentation. And so what are some of the work that we're doing now? So what we're doing is we are focusing on, as a coalition, really leveraging the partnerships that we have. We're looking at strengthening community partnerships with, with community sectors that have not been, for example, brought to the table, and whose perspectives that we have wanted to get for a long time. And so we'll be reaching out to more community sectors, such as individuals involved with businesses, so business owners, doing more work with faith and civic-based organizations, strengthening our collaborations with schools, et cetera.
Thank you, Dr. Carpenter. That was great. Thank you guys so much. We're actually doing great on time. I'm very proud of us because we were all being very mindful that once we are in a room together or on a virtual platform together, we tend to like to chat a lot together, because you'll get to know the coalition is like a huge family, and we work together to, as Cass said, we want to be able to hold each other accountable, to see what can we do together to help our community, what are new ways that we can come up with new efforts to serve our community and to reduce substance use in the Dearborn and Dearborn Heights community. We are now at our Q&A portion of today's webinar. If you have any questions, you can go ahead and stick them in the chat box or press the raise your hand button and we'll unmute you. So I do have some questions that were sent to me prior. So I'm going to go ahead and start off, and then once the questions come in, we'll get to them. So this one is opened up to all of the speakers. What's your advice to someone who's considering using cross-sector collaboration to achieve their organization's efforts?
I can speak to that from the perspective that our partnership in HES Academies with ASAP has been very practical and useful and efficient. It is the coalition that you have put in place has introduced us to so many channels and so many community resources, and all in one place, all gathered for one concern, but it branches out to really a lot of useful outcomes of these relationships. So there's definitely synergy in community collaboration. I don't think it's even the question of what is the benefits of doing it in a collaborative manner. I think the question is, can you do it without a collaborative manner? I think the only way to achieve goals that are community related is to collaborate with various community organizations, because you make your job a lot easier.
Right, I agree. I think we can say that we always say we are as strong as our partners. If we try our best to be a one-stop shop, but if we are not able to provide someone with any type of services, then we do make sure that we find one of our partners that is able to provide those services for people. I have to say that I've never been more happy or humble to be in a position that I am today than I am during the pandemic, because it's where I belong. It's being able to be on the front lines. I remember when the first week that we were sent home, I think it took us like less than a week for all of us to just start going. And the agency started testing, and then we continuing, we're testing our first responders, and then we started testing our community members, and we were all over the place, all over Michigan. And when we came back home, when the testing sites came back home, Then we pushed in our outreach efforts so that we were able to, to do our resources, like we were thinking like, how are we going to be able to reach people about, for example, about SUD prevention. So we would go to the testing sites and we'd go to the food drives and we would educate our community on, especially with the increase of use of substances during the pandemic. We've seen that, many people were turning to substances if it was a past substance they used or something new, and tobacco is one that we know was increasing. And COVID was a problem for a health concern for lungs. And so we were, educating our community as much as possible about tobacco use and the harms to your lungs, and to, people who needed to be more proactive with their health during the pandemic, so that they could take all the precautions when it came to COVID. And then, now we're on, hopefully a better future with the vaccine sites and getting people vaccinated. And again, on the ground, I know that the agency is over 20,000 people that they have vaccinated and counting. And we, as well, once we are working on our vaccine sites, we offer other resources with our partners, and also provide our community with our preventative, like when it was Kick Butts Day, the DEA Take Back Day. These are all Red Ribbon Week. We utilize these events to educate our community and to stay connected in our community. But again, this can't be done without your partners. We all have to work together. If you've been in a coalition meeting, I say, we don't want to focus on blaming anyone for what's going on. We want to focus on working together to help others and to be the voice for the voiceless. And so I do believe in partnerships, and I do believe in collaboration to be successful. So I do want to open it up if anyone has any questions, or if the speakers have any comments they'd like to make at this time.
Yeah, I would just like to kind of add on to the importance of cross-sector collaboration. This is extremely important when we're working with marginalized and traditionally overlooked communities. And as a researcher, especially, and I'm going to use my own experience as an example, because I am not Arab American, I am not Muslim. And so this was really what I love most about this partnership that I have with Access and with the ASAP Coalition is that I have my own cultural competency and cultural humility has expanded so much beyond what I thought it would. And for me, going into this partnership with the spirit of, I can tell you all about the science and I can talk behavior change theory with you all day long, but I don't know the culture. I don't know the customs and the traditions, because I'm not even from Michigan. And so for me, approaching our partnership as a learner, I have found that it really helps. And especially for researchers working with communities that they're not familiar with, that they have no lived experience in, it's important to bring community members and bring multiple sectors together and approach it as this is a learning opportunity for all of us, because each person in a community, regardless of the community, has their own unique set of skills, capabilities, and knowledge. And with the community really being an organism, a living, breathing organism, we need all the community sectors to come together. We need that cross collaboration to really help highlight and magnify the voices of those whose voices have been silenced for so many years. And this is one way that we can address substance abuse in the community. This is a way that we can bring awareness to people who are policymakers, bring awareness to funders, so that resources can be brought to the community to address substance use and other conditions.
Thank you, Cass. I have to agree. I remember when we started working on this, I think that was part of, the idea of our training through our research project was, history has shown that researchers going into a community that they were not familiar with wasn't comfortable for people. It wasn't comfortable for community members. There's a lot of fear that comes along with knocking on somebody's door. And so when you come to the idea of partnering with a community organization that's has a trustworthy reputation in the community, has been around, we're in the neighborhood, we have a familiar face, we understand the community, then it's a more of a comfort level when you're trying to collect that data. And, I remember from my own personal, the struggle was, I talked to Dr. Carpenter, what are we going to do? There's no data. It's very limited. We got to put our community on the map. Of course, Access is a diverse, welcoming, we have 19 different languages that's spoken at Access. We have everyone, of course, is welcome. Everybody walks through our doors, but the community is predominantly Arab American. When it came to the prevention efforts, it is a predominantly Arab American community. And so to show that there is a need in a community that is not on the US Census was a struggle. And we had to do our own work, and we had to do our own surveys, and we had to put ourselves on the map. And I do remember when we were at the training for the coalition through the DFC, we had to go to a academy training, and it was like school all over again. And we met people from throughout the United States, from all walks of life, and they didn't know, They were very surprised. They had no idea. And it was about us learning from other communities and educating about our community. And one thing that we know is that substance use, mental health, suicide, this is across the nation, across the world, this is affecting all walks of life. There is no face to it. It is something that, anyone can struggle from. And that's when we wanted to break the stigma around it. What does it look like, or who does it look like? There is no face to it. It is something that anyone could be going through. And so we want to make sure that we are helping those. And we also want to make sure that we are providing the preventative factors for all communities and, serving our community. I don't see any questions from the audience right now. If you would like to email me your questions, feel free to email me. I'll leave my email in the chat box. The last question I have for our wonderful speakers today is, what's the most rewarding part of being part of the coalition? As I smile at you and hope you guys feel rewarded to be a part of our coalition.
I think I've mentioned it.
Go ahead.
I've mentioned it already. We've done over, I'd say, I don't know, 20, 30, 40 sessions other than live sessions and the different tablings during events. All the resources that have been shared with our community. I think the amount of, basically we created a direct channel between ASAP and our school community to spread the information about substance abuse, mental health, and everything that ASAP is trying to work on. So that collaboration has really hit the target that we want, and the goal that we want from the mission of ASAP.
Thank you, Isam. Aaron.
Oh, the most rewarding. And selfishly, I think it's just being able to see the outcomes. As a police officer, we show up to somebody in jail and then we leave. With this coalition, the follow-up, we can see the outcomes. We've gotten, I think, 59 people into treatment with Access that wouldn't have treatment otherwise. And when I see them in the community and they come up to me and tell me how they're doing and doing well and haven't relapsed, it's positive. And on the flip side, when they tell me that they have relapsed or they're using again, It just shows me the trust that they have with the police now that they wouldn't have had in the future. Telling an officer, yes, I'm doing something illegal right now. Just the trust that they have to say that without fear of being arrested. It's just pleasant to see.
Thank you. Captain Corey, one of our new partners.
Yeah, it's tough to draw on any positive feedback quite yet with the success stories, but I did look at some data that was provided by Ahmed Balut, and there has been a lot of people that have committed to at least hearing out the counselors and seeking rehab. You know, I guess the rewarding part for me is knowing that you guys and partnering with our officer on this rapid response team, you're not only providing help with SUD, you're actually helping with getting the community Narcan training and teaching people how to snap somebody out of an overdose if that happens within their household, unfortunately, which it does happen. I think the whole process of this coalition has been nothing but positive for our police department.
Thank you. And Cass, I'm going to call you Cass now.
Thank you, finally. So for those of you, most of you may not know, but when I'm in the community, I hate being called doctor because I believe that my PhD doesn't make me who I am. And even without the PhD, I would be doing the same work. So yes, you don't have to call me doctor. Cass is fine. For me, the most rewarding part of this partnership is that I get to work with fantastic people in the coalition, and I get to use my knowledge, my experience, and the science to empower and uplift and highlight the voices of a community that I have cared about and have had love for since I was 18 years old. So for me, working with the Arab American community, working with people from the Middle East and North Africa, working with people who follow the Muslim faith, you know, working with these communities, this is one of the reasons why I went into research in the first place. So for me, this is living a dream.
Thank you. Well, thank you guys all for joining us. Thank you to all the wonderful speakers and all of the wonderful, we have a whole line of wonderful ASAP partners, including our youth and our parents and our schools and our faith community, everyone who supports us on different efforts. You guys are the reason why we are where we are today and able to do the work that we are doing today. And to end this, I have to say that for me, this is a reward every single day of my life being part of this work, because I was asked the most unique question a couple of years ago, or a few years ago, you know, what do I want to do with my life? You know, what is my goal? And I'm like, I don't know, but I know one thing. I just want to help people. And that is what I've been able to do every single day for the last 5 years, being part of this work. And it's a blessing for me every single day. And to be able to help people and to be able to, you know, even if like many of our speakers have said today, sometimes we are just the middle person between the coalition and the agency to the community. And, you know, it could be you come to us for to hear about our prevention efforts, but you walk out finding out that we have a social services department, or you need health insurance, or you need to see a medical clinic. You know, we make sure that you're offered all of the resources that we have at the palm of our hands. And, you know, it is a reward and a blessing. And we just want to thank our partners, our funder, the CDC, ONDCP, the Detroit Wayne Integrated Health System. And so I hope everyone has a wonderful Monday. It's sunny here in Michigan, finally. Enjoy your evening, and we look forward to seeing you tomorrow. At the same time, our youth group will be on tomorrow. They are such a cool group of kids. They're going to be talking about tobacco law, and you will get to hear from them. So again, make sure you guys sign in if you need the CE credits. And if you have any questions, please feel free to reach out to me, and have a great evening. Thank you once again.